New York might have undercounted COVID deaths in the state's nursing homes by as much as 50%. That's according to a new report from New York Attorney General Letitia James. NBC News investigations correspondent Tom Winter here now. Tom, that is an incredible difference and just horrible to think of how many people may have died in New York's nursing homes. What happened here? What is the AG saying?
Right. So a couple important things here, Allison, and we have to go back to the first wave of this pandemic. And remember, you and I talked so often back then, and it was just one awful headline and one awful story after another. When we go back to that time, there was an edict that was issued by the New York State Department of Health in line with federal guidance and CDC guidance that said, look, we anticipate the hospital situation to get really bad and not have enough beds. So if a nursing home patient goes to the hospital and is in a position to be discharged and be taken care of back at a nursing home facility, that should happen. So you should take a COVID positive person at the hospital. If they don't need to be hospitalized and put on a ventilator, then you should send them back to the nursing home. That turned out to be a bad idea. Now, there's a number of reasons for that, and you and I are going to discuss some of the issues with the nursing home in a little bit, and we can discuss some of those problems that led to that becoming a deadly decision. But essentially what we had happen here is that a number of people died at nursing homes. That order was then rescinded because it was such a problem at the nursing homes. The governor, New York Governor Andrew Cuomo, was heavily criticized for this. And so today's report says that when we look at the totality of the deaths, we're not going to find twice as many people died here overall of COVID-19. That's not what this is about. But when we look at what happened here today in this report from the Attorney General, it says, look, if you look at the pool of people that died, unfortunately, from COVID-19 that were elderly, that were at nursing homes, we're going to find that the amount that died at nursing homes versus other locations, that number is short by perhaps as much as 50%. And so that's something that's being taken a look at. Why was that reporting that way? And why did the Department of Health report it the way they reported, Allison?
So, Tom, you alluded to this. This report says that a, quote, lack of compliance with infection control protocols put residents at an increased risk of harm. What does that mean in plain English? And also in simplest terms, what are some of the other issues here that they're looking into? Right.
So, you know, one day people will put these types of things in plain English and I'll be out of a job. But until that happens, my research indicates and our reporting indicates, as we've been following this, something actually quite serious and quite grave. That essentially the basic protocols, talking about washing hands, talking about PPE use, changing PPE use after you work. You know, you visit somebody in the nursing home in one room. They may not have COVID-19 at all. You then go and visit somebody who's got as a nurse or as a healthcare worker who's got COVID-19, and then you go to another patient that doesn't. Are you taking that infection with you? Are you doing the necessary hygiene and cleanliness procedures that we can all now recite before you go from patient to patient, nursing home resident to nursing home resident? That was a major failure here. Another failure here coming right from the report, 76-page report, is that for-profit nursing homes' pre-pandemic low staffing model simply snapped under the stress of the pandemic. So it wasn't enough staffing that they had at these nursing homes to be able to take care of so many of these patients when they got hit with this awful, awful virus, Allison.
Tom, you mentioned Governor Cuomo earlier. He has not publicly commented on the report as far as I know, but New York State Health Commissioner Dr. Howard Zucker did release a statement that says the New York State Office of the Attorney General report is clear there was no undercount of the total death toll from this once-in-a-century pandemic. What are other top officials saying?
Right. So that was a 1,688-word, full-throated response to this. It is an issue that has been heavily criticized by New York State lawmakers. It's been an issue that's been heavily criticized by certain corners of the press and the governor's decision here. It's also an issue that was criticized by somebody who he kind of goes back and forth with. They don't have a great relationship with. That's New York's Mayor Bill de Blasio. Let's take a listen.
Yeah. We have to get the full truth, and we have to make sure it never, ever happens again. Nothing like this happens again. And we have to be honest about the numbers.
So, Allison, to take people a little bit inside the New York State political scene, if you will. The two have not had a great relationship. It is a relationship that has been further strained by this pandemic, the decisions made by the governor, the attempted decisions made by the mayor here. So it's not surprising that the mayor would chime in on this. However, the mayor does have a point. There is going to be more of a more thorough investigation that continues here. The Attorney General alluded to that herself today, Letitia James. And so I think there's more information that needs to come out. Was this a lack of poor reporting by nursing homes who didn't want to get in trouble with the Department of Health? That's possible. Is it also possible that the Department of Health here tried to play hide the ball with deaths and something that the governor had been criticized? That's something that's going to bear further reporting and further investigation.
Yeah, Tom, thank you so much for explaining that relationship, that unique relationship, because those of us New Yorkers are very familiar with the fact that these are two Democrats who don't always see eye to eye on things. But I think people outside the state might not be quite as aware. And I just have to say, I think it's going to be a very long time before we start getting reports in plain English. So I think of all of us, you may just have the best job security in town.
Probably right. Thanks. It is an important issue, and we are definitely going to stay on top of it.
We are so thankful that you did, and thanks for explaining it to everyone in terms they can understand. We appreciate it, Tom. All right, let's bring in Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation, also former acting CDC director. Dr. Besser, that report we just heard from Tom Winter about New York nursing homes is heartbreaking. It's terrifying. Regardless of what the final findings are, it's scary to even think that perhaps those deaths could have been undercounted by as much as 50%. What is your reaction from a public health standpoint? How could we have avoided something like that? And if it does, in fact, turn out to be the case, what do we need to do here?
Well, I'll leave the politics of the story aside. What it says to me is that the recommendation that long-term care facilities, people who are residents and people who work there, need to be a high priority for vaccination is the right recommendation. When you look at the risk of getting infected and the risk of dying from COVID, it's extremely high in long-term care facilities. We saw that here in New Jersey, where I'm located, and I have real concerns that if the quality of data that's coming through and is being reported isn't accurate, it makes it very difficult to know whether any intervention that you're taking is having an impact. You need data that is accurate. You need data that you can break down by geography, by race, by ethnicity, to make sure that you're doing all you can to protect lives wherever disease may be transmitting.
Dr. Besser, we know that nursing home residents and workers were among the first to be offered the vaccine. We also know, though, that vaccine distribution has not been terrific around this country. How high is the danger right now to our elderly population, and how can we best look out for them and act in ways that helps protect them?
Yeah, there are a couple issues there. One is the challenge about distribution. How do you reach people in all long-term care facilities? There's issues in terms of vaccine supply and how much vaccine there is. But there's also real issues in terms of vaccine hesitancy. And what I'm hearing is that there are a lot of workers in nursing homes and other long-term care facilities who have concerns that the vaccines haven't been studied long enough. They want to see a longer period of time to have more safety data. And so, you have to meet people where they are, understand what people's concerns are, and be ready to recognize that someone who may be hesitant today may want to get a vaccine tomorrow or next week, as they know friends and family members who've been vaccinated. And you want to make sure that it's not a one chance to be vaccinated and done, but that high-risk individuals have many opportunities to learn more and to reconsider their decisions.
Dr. Besser, I forget this sometimes, but you were also a pediatrician, and we know COVID cases in kids are going up, according to the American Academy of Pediatrics. We also know more contagious strains are circulating right now in the U.S., including that South African variant, which turned up today in South Carolina. Do we have any idea how these new strains impact kids?
We don't. This is one of those unanswered questions. Here in the United States, some of these new strains, the UK variant and the variant out of South Africa, are newly identified here in the United States. The CDC is ramping up the amount of surveillance they're doing. So what I mean by that is looking carefully at strains to see what mutations, what mutant strains may be here. In terms of children, we're seeing the same kind of distribution and disparate impact among children that we see among adults. So Black, Latino, Native American children are being infected at higher rates. They're being hospitalized at higher rates, and the chance of dying, while still very, very low, is much higher in those groups. And it's likely because of increased exposure risk, more likely to live in a home where parents are going out to work, more likely to live in a multi-generational household, so maybe more people in the household. So we have to do all we can to reduce transmission. And a lot of that comes down to protecting people who are out working, essential workers. We're not doing enough. Yeah. It's much harder to craft vaccine programs to reach those individuals. And I worry that we're so focused on the number of people vaccinated that we're not focused on, are we putting the vaccines in the right arms? Those people who are at the greatest risk of being infected, of being hospitalized and dying. And without good data, it comes back to your questions about nursing home. All of this is contingent on having good data so you know what you're doing and where the gaps still lie.
Dr. Besser, how about pregnant women? We do not have trial data for pregnant women right now. And now the WHO is recommending against both vaccines for most pregnant women. Could you explain this one? What is the reasoning here?
Yeah, so the headlines are a little different, I think, than the text on this recommendation. It's pretty similar to what the CDC is saying. And that's that, yes, these vaccines have not been studied in pregnant women, but the risk of COVID is great. And the thinking is that these vaccines will be safe. And so what their recommendation is that pregnant women should talk to their doctors. But if they work in a high risk setting, a setting where they're likely to be exposed to COVID, they should consider getting vaccinated. There will be ongoing studies to look at the impact in pregnancy. There's no reason to think there would be an issue. So my takeaway is if you're a low risk individual, you're not going to be very likely to be exposed to COVID. Then you may not want to get vaccinated. But if you're working in a setting where your chances are high, if you're a healthcare worker and you're dealing with people day in, day out who have COVID, there you really want to talk to your healthcare provider and think about getting vaccinated.
Dr. Besser, thank you so much. You always help us to see past the headlines and understand the full reality of the situation. We're very grateful for you.
Thank you, Allison.
First the vaccines, then the vaccine misinformation. You may have seen the false rumor online that COVID vaccines cause infertility. That is not true, but it hasn't stopped that claim from spreading on social media. NBC News Now correspondent Simone Boyce here to fact check for us.
The concern I have, and something we're working on, is getting people who have vaccine hesitancy who don't want to get vaccinated. So we really need to do a lot of good outreach for that.
Even before the coronavirus pandemic, the World Health Organization listed vaccine hesitancy as one of the top 10 threats to global health. Now that COVID vaccines are rolling out, health experts are worried not enough people will get them to get us to herd immunity. One piece of misinformation causing some concern that the vaccine will somehow lead to infertility. Spoiler alert, it's not true. But it's still a false claim that's been spreading on social media. So let's separate the science from the science fiction. It all started with this image shared by users on social media. Now, there's a lot in this image that just isn't true. The doctor mentioned in the post is not the head of research at Pfizer. The image also falsely claims the vaccines contain a protein called syncytin-1.
That's a protein that's necessary to have the placenta form. When a woman becomes pregnant, you need the placenta that attaches the embryo. So it has a protein in it. That there was a scientist who said that this protein protein was going to be attacked by the antibodies that result from this vaccine.
Dr. Jill Foster is a pediatric infectious disease physician with the University of Minnesota Medical School who studies vaccine hesitancy. She says even though the coronavirus spike protein and syncytin-1 share some features, they're actually very different.
So the way I talk about this is you and I both have a phone number that has a 7 in it. So somebody can dial 7, they're not going to find us. We don't live in the same house, you know, and so we're not the same. So proteins are made up of different components, and both of the protein that is the spike protein and the protein that is this protein that forms the placenta have some similarities to them. But it would be like us both having 7 in our phone numbers.
We also have hard data to point to the fact that coronavirus vaccines do not impact fertility. In trials for the Pfizer vaccine, patients were given pregnancy tests before taking part in the study. They couldn't take part if they were already pregnant, but 23 patients got pregnant during the trial, 11 in the placebo group and 12 in the vaccine group. A spokesperson for Pfizer telling the Associated Press, quote, "It has been incorrectly suggested that COVID-19 vaccines will cause infertility." But according to Dr. Foster, there's another easy way to debunk false claims about fertility.
If you think harder about it, if you get coronavirus, you're going to make antibody to the coronavirus. All right? It's the same way that you're going to make antibody to the coronavirus from this vaccine. And yet we have not seen any decrease in fertility from people having coronavirus. So if you're going to say that the vaccine causes it, you would also have to say that the disease causes it, and we've just not seen that.
If you're pregnant or breastfeeding, health officials say to talk to your doctor before getting vaccinated. Clinical trials for pregnant patients haven't started yet. However, we do know that patients who contract COVID while pregnant are at a higher risk of severe illness.
They are much more likely to end up needing a ventilator, end up in an ICU, and that's both very bad for them, and it's also very bad for the fetus. And so, you know, there's, you know, a lot of bad outcomes come from that. Women who are really, really sick, then the obstetricians often deliver the baby early, so that you have a premature baby, and a baby that otherwise would have just gone to term and then, you know, had a normal birth.
What we do know, you can't get COVID-19 from these vaccines. Dr. Foster says if you see a scary claim going viral online, check with a reputable source.
Things get amplified so quickly in social media. And unfortunately, it's the negative messages that get amplified so much more quickly. I mean, it's very easy to just make up some theory on something. It's very hard to then shoot that down.
That's why we're here to help.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.